In this video, we're going to be teaching you what to expect if you're having an induction of labour or a caesarean section, whether it's planned or an emergency.
There are three main steps to the process of induction. Usually, this starts with a pessary, gel or vaginal tablet which is inserted in the vagina and will release the hormones to aid your cervix to soften and shorten. Your cervix may take 6 hours or more to respond to the effect of the vaginal medication. Once your cervix has started to change and has dilated 1 to 2 centimeters, then the second step can be completed, which is where the midwife or the doctor will break your waters through a vaginal examination. After this, we will soon be starting the oxytocin hormone drip. The oxytocin drip is started only if there are no strong contractions and it is required. This starts off at a small amount and is increased every 30 minutes or more as per individual requirements to increase the contractions, and this will continue till your baby is born. Your process can take some time. Everybody's body is different and they respond differently. It is also important to know sometimes the induction does not work. Your doctor will be around to discuss these scenarios with you if this should occur.
Now, I will talk you through cesarean section and what to expect from start to finish. Firstly, you will be met by a nurse or a midwife who will check any preferences you have for your C-section. We will then take you into the theater where the anesthetist will prepare your back for the spinal anesthesia. It works very quickly, and once you have this, we will lay you down onto the theater bed. The team will then clean your bum to make it sterile and place a catheter to drain your urine. For this part, we will ask your partner to remain outside to the theater to ensure sterility. We will invite them inside the theater before we start. From start to baby being born is usually less than 10 minutes.
At this time of birth, you may feel a little bit of pressure on your tummy. If you wish, we can lower the screen so you can see baby at birth during the delayed cord clamping. This is before we clamp and cut baby's cord. Depending on baby's condition at birth, we may be able to do immediate skin to skin. However, we may need the paediatrician to check baby before this. We would explain this to you at the time. Situation dependent. The rest of the C-section usually takes around 45 minutes. During this time, we will do baby's initial checks, skin to skin, or we may even be able to feed baby for the first time, if they're ready. Once you are finished in the theatre, you will go through to the recovery area for around 30 to 60 minutes. This is to closely monitor you and your baby before transferring you to the 6th floor, where you normally stay for about 3 to 4 days.
You had preferences for a normal birth. However, a C-section can sometimes be needed for your benefit or for your baby's benefit. And sometimes a C-section can be planned from the beginning for certain medical reasons to keep you and your baby safe. Sometimes during labor, a C-section can be indicated for your benefit or your baby's benefit. Remember, at the end of the day, you want a healthy birth and a healthy baby.
Your recovery from C-section can take up to 6 weeks. Your doctor will guide you on your recommended practice for healing of the wound in terms of dressings and medications. Research shows that early and frequent mobilization in your recovery period is key, from as early as 6 hours post C-section, depending on your condition. Within your hospital stay, we will give you pain relief as you require and reduce this before you discharge, so you'll feel comfortable and confident before going home. You will be given medications with instructions and take home also. Remember, we have home midwife services to check on you and baby after discharge and check your recovery and wound healing too.